Good afternoon, everyone, and thank you for joining us here from Living Well in Geneva again. My name is Kevin Most. I'm the Senior Vice President of Medical Affairs at Central DuPage Hospital, and I appreciate the opportunity to get in front of you guys again and talk. It was just a mere 4 months ago that we had a conversation, and kind of interesting things I probably might have said 4 months ago may not be true now, but I can tell you one thing that is true, and that's the staff at Living Well misses all of you and really hopes you are staying safe and healthy, and can't wait for the day when you can all get back here on campus with them to do all the great things that you're doing. But I hope everyone understands that Living Well continues to have over 100 virtual platforms or programs that you all should be participating in and taking advantage of. We're going through difficult times, all of us are, and some of you who are listening are going through more difficult times than many. And we know that importance of camaraderie, that importance of social interactions is very key to your lives and makes your lives easier. And we're sorry that we can't provide that now, but just know that the staff here misses you, and hopefully you are participating in those. I'm going to go through just a couple of things just to kind of give everybody an update, a little bit of inside baseball as far as what's going on, and then we'll be able to take some of your questions as well. I know a lot of people have interest in the vaccine, and there's been a lot of news on the vaccine recently, so I thought I'd give you an update on this. We're in unprecedented times. You know, the fastest a vaccine was ever made in this country was 4 years from start to finish, and that was the measles vaccine in the early 60s. If you look now at what's going on across the country and around the world with COVID vaccines, it is absolutely mind-blowing. And the reason I say that is we have over 150 companies, universities, countries that are trying to build a vaccine and trying to develop a COVID vaccine. Certainly you're hearing just mainly what's going on here, but I assure you that some of the information that you're hearing from China and Russia may be a little disturbing. So let's keep our science and our data here in the United States, and we'll focus on what we can do and what we are doing. I know many of you may be disappointed as you heard the 2 vaccine studies that were in phase 3 were stopped in the past. One was stopped a couple days ago and one was stopped in September. The AstraZeneca vaccine, which one that had started in July, had put a pause on here in the United States in September due to an unexpected illness. That vaccine trial has been regenerated around the world, but is still on hold in the United States because of some concerns. Probably the one that's a little bit more disappointing is the one that came out yesterday, and that's the Johnson & Johnson vaccine, and that was halted. That study was halted yesterday. Now, I'm going to say 2 things. One is about halting a vaccine. We do that out of preponderance of safety. Now, this is the first time that I know of where media is actually, and the public is actually informed about trials being halted. So I want to reassure you all that trials are halted all the time. Trials are halted because they found out a piece of information in the middle of a trial and they stopped it to make sure that no harm would go forward. You may not hear about it, but it does. It happens in oncology trials. It happens in all trials. So please don't be concerned when you hear that AstraZeneca and Johnson & Johnson trial were halted. They're checking on the individuals that had these unexplained illnesses. They're checking to see if the individual got the placebo or actually got the vaccine, and they're checking to see if there's any interaction. They do that out of a preponderance of safety for those who are going to continue to sign up for that trial. So please don't be disappointed. Now, the reason I say that we might be a little bit disappointed about the Johnson & Johnson vaccine is all the other trials are 2 shots. So you need to get an initial shot, and then a month or 2 later, you're getting a booster. Johnson & Johnson was the first one to come out with a single-dose vaccine for COVID. That's why our hope was with this and continues to be very high with Johnson & Johnson, and hope that they can rally back and that this one unexpected illness had nothing to do with the vaccine. The goal would actually be to have a 1-shot vaccine. And the reason I say that is we know a bunch of things about individuals that need to get 2 shots. One is the compliance is not as high. Now we know that COVID hopefully will have very high compliance because we hope that by the time the studies are done, we're going to make sure that we know that they are safe. anytime you get a vaccine, and for those of you who have, you've gotten the influenza vaccine. Hopefully many of you have gotten the shingles vaccine. You know there's discomfort there. Some people get a little low-grade fever. Some people feel a little achy. Sometimes those little mere side effects make you forget that you're supposed to go back for that booster shot. So that's why the ability for Johnson & Johnson to prevent a one-shot vaccine would be great. So please don't be discouraged. Keep that in your mind. The other thing I think that we all have to realize is that this is not a one-horse race. This is not a first one to market is going to win. As a matter of fact, we'll probably see at this time next year, I would bet you somewhere between 10 and 15 different companies that are going to be making COVID vaccines. So don't worry about ones and twos and the early ones. We know that there's plenty of other opportunities out there. That being said, one of our other concerns is the misperception that, oh, we'll have a vaccine before Christmas, or we'll have a vaccine before the election. Let's make sure we're very aware that not only the ability to have a vaccine is one thing, but then we have to go in and produce, distribute, and vaccinate people. So we know that as soon as the vaccine is available and proven to be safe, what are we going to be doing? We're going to be looking at how it's going to be distributed and who's going to get it first. Hopefully what we'll see is that first responders and the health professionals get it first. And then we're going to look at nursing homes because that's where we've seen a preponderance of these vulnerable people becoming very sick. And then after that, it's going to continue to be the vulnerable population, many of who are listening today. So you will be one of the first ones to get it. As far as the general public, we really don't expect the general public to have enough vaccine available probably until about this time next year. So that's a little bit of the lowdown on the vaccine. Let's talk a little bit about President Trump, because I know many of you had concerns or questions regarding his treatment. And I should say more, not concerns, but questions. So President Trump is probably one of only a handful of individuals who got the mix of drugs, a cocktail of drugs, I will say, that he received. And I won't get political about it. I'm going to talk about the science behind it and try to hopefully everyone will understand. Certainly we've all heard about remdesivir. Remdesivir is an antiviral medication. What that medication does is it tries to stop the virus from replicating. Those of you who had influenza in the past were given a prescription for Tamiflu. That's a very similar concept. Influenza runs 10 days. We know if we take Tamiflu early on, we could shorten that to 6 or 7 days. Same with remdesivir. Showed that we shorten the duration by stopping the virus from replicating. So we actually impacted how the virus would continue to spread. Regeneron, if you heard about that one, that was the antibody cocktail or antibody medication he got. And people were saying monoclonal. It really wasn't monoclonal, it was polyclonal. And what that means is that there was more than one medication in that drug that he received. This is one that's kind of interesting because right now it's only being used in a very small trial of about 275 people. Dr. Sean Conley asked the FDA for something called compassionate use, where it was extended to him, which allowed him to give this to the president. The monoclonal antibody test works a little differently than remdesivir. What it does is it stops the virus from getting inside the body's cells where they take that opportunity to replicate. So if you saw what happened here is you saw a drug being given to slow down the replication of the virus and to slow down that the virus would even interact with the body or get into the cells and have ability to replicate. And then the third drug he got was the steroid, the dexamethasone. That one was a little bit unusual and caught a lot of the medical profession off guard because dexamethasone, the studies being done for COVID, showed that it's great for those getting supplemental oxygen and great for those on ventilators, but really showed no impact on an individual who was not getting any supplemental oxygen or not on a ventilator, and in fact showed some detriments to it. That drug is normally given for 10 days. It appears that the president got it for about 5 or 6 days. So Dr. Conley and his team probably said, hey, we're not getting the need that we need out of this. You appear to be doing much better. Let's stop this drug before it can do any more harm to us, potential harm. So that was what's going on with the president. We wish him well health, and it will be interesting to see how both the remdesivir studies that are continuing to come along, as well as the Regeneron. So those are two of the questions that you had. Another question someone asked was about the neurologic complications of COVID. You've probably seen that in the news quite a bit now. It's called COVID fog. It's very concerning because the number of people that are getting it is quite high. 25–30% of people who have full-blown COVID are now getting something called COVID fog, where they are forgetful. They have neurologic symptoms of can't remember some things, so some memory loss. We know that COVID is an unusual illness. It's not like influenza, where influenza is going to give us bad upper respiratory and in some people pneumonia. COVID, unfortunately, has decided it's going to do more than that. It not only hits us in the back of our nose and throat and gives us that upper respiratory infection, we know what it's done for individuals with pneumonia to a point of needing to be on ventilators. We also know, unfortunately, that can impact the heart and has caused heart failure in some people, and is actually even called kidney disease and neurologic illnesses. So the COVID fog appears to be one of these side effects from the COVID illness. What's it due to? We're not sure. We're not sure if it's due to an increased immune response in the brain. We're not sure if it's caused by inflammation of the blood vessels in the brain. We know it occurs, and we're starting to track more and more of it and trying to figure out, is there a treatment for it, or is it just something that we need to look out for? So COVID fog is something you'll start to hear more and more about. And if you remember back on June 4th, our list of symptoms was probably quite smaller than it is now. And now we will start to see more things like COVID fog, more things like kidney issues and heart disease that we're concerned about the long-term effects. Back in June, we were really looking at more of the immediate effects and what's going on in the hospital setting. Excuse me for a drink here. I think the other thing that many of you are concerned about is what we're hearing across the country and around the world as far as testing results and what's going on. Our neighbors to the north, Wisconsin, are having a very difficult time right now, close to what we were having in May and June. And if you look into Indiana now, their rates are up as well. If you look across the country, the rates are up. Is this concerning? Absolutely. I can tell you at Central DuPage, we had a peak of 97 people in the hospital at one time, and of those 97, 50 were in the intensive care unit. About 3 weeks ago, maybe a month ago, we got to a low of 8 patients with no one in the intensive care unit. Today, I'm sad to report that we're close to 30 back in the hospital now and have patients back in the intensive care unit. So whether this is the second surge that's coming, whether this is just a continuation of the first, is unclear at this point. And the reason I say that is it's going to be depending on what the trend does. If it's a continuation of the first, we're going to clamp down a little bit, and we should see these numbers, at least in the hospital setting, stay in that 20 to 30 range. If this is a resurgent and a second surge, our concern is that we're going to start to continue to see an increase, and that's certainly something that we don't want to happen. We don't want that to happen for many reasons. And I really wish that I could get the point across that this is the part of ownership that we all have. This is the part that if this is just a resurgence, if this is just a continuation of the first wave, that we all own it. Wear your masks, socially distance, wash your hands, do the right things. If this is a second surge, we need to do all those things, but also be prepared, because at that point, we start to put a stress on the healthcare systems, and when that happens, we stop elective surgeries again. We stop colonoscopies, we stop mammograms, we stop all those things that we know, how many of you are listening, how important it was in your lives that you had some of that screening testing done, that you had some of that surgery done, and the impact that it had on your illness. So we really hope that everyone right now is as vigilant as possible. This is not a time for complacency. This is actually a time for us to step up and to make sure that we are very good at doing everything we all can do personally. Don't worry about what's going on in the hospital. We're doing everything we possibly can. But as individuals, we really should work on what we can do, and let's be role models for everyone. What can I do to improve my immune system? This is a great question that everyone should hopefully take a couple minutes and stop and make a list and a checklist of, are you doing these things? We listen to the immune system and we say, okay, what can we do? Well, from a personal point of view, there are some things that you can do from a dietary view. One, let's make sure we're eating healthy. You know, we all love a McDonald's. We all love a fast food. But you know what? I don't just want to say this flippantly. This is not the time for us to decrease our impact on what our diet has on our health. So please, everyone, try to eat as healthy as you can. Take a multivitamin. You know, the vitamins that we're concerned about for immune system are obviously vitamin C, vitamin D, vitamin B6. So really, if you take a great multivitamin, that's wonderful, especially now coming into the fall. Our sunlight time is decreased, so our natural vitamin D that we get from the sun is not there. So please, when you're taking your multivitamin, make sure it has vitamin D in it, or take a vitamin D supplement. So important. Get your rest. Don't stay up late watching late night TV. Turn off the news. Get your rest. A good night's sleep is so important for our immune system. And exercise. You say, wait, is it rest or exercise? It is both. You can rest, and if you get a good restful sleep, the importance of exercise cannot be minimized with your immune system. And decrease the stress in your life as much as you can. I know we're all going through very stressful times. Let's not add any additional burden of stress that we need or that we put on ourselves. So minimize whatever stress you can. So if you rest, get a good night's rest, exercise, decrease your stress, eat healthy, take a multivitamin, you're doing everything you can for your immune system. So those are the things that you can personally do to boost your immune system. And please, everyone should do it. You probably went through that checklist and said, well, that's something that I should be doing anyways every day. Couldn't agree with you more. Our immune system is so important, not only for COVID, but for influenza, for any other illness that we have, and actually for a lot of oncology patients, you understand the importance of your immune system. And I'm sure it has been discussed with you either by Dr. George or Dr. Eisner or whoever, how important that is. So please, I hope everyone is doing that. With flu season on the way, you know, is there an obvious way for me to tell if I have flu? Do I have COVID, or do I just have a cold, or do I have seasonal allergies? I wish I had an easy answer for this one. And the reason that it's so difficult is COVID, again, happens to be one of these illnesses that has decided to write its own playbook. And what I mean by that is we probably have about 50% of people who have COVID have no symptoms whatsoever. So with that large of a number of COVID patients walking around with no symptoms, how do we identify those that are? Well, if you have influenza, and those of you who have had it, you know and probably will never miss an influenza flu shot again, it often comes on suddenly. Where COVID is, we're starting to see more of a gradual fever. Influenza is usually one where you're feeling fine, and then, boy, an hour later, you have a very high fever. But the onset of fever is probably really the only one that's differentiating, because the upper respiratory impact of influenza is similar to COVID. The pneumonia portion of it can be similar to COVID. So there's really no quick way for me to say, boy, this is going to tell you if you have COVID, this is going to tell you if you have influenza. Now, seasonal allergies, it's a little bit easier. One, we usually have a history of them. We know when we're walking into allergy season, and boy, if you're going to get them, you know you're going to get them. And if you're taking your Zyrtec or you're taking your Flonase or the medications, and those make an impact on your symptoms, then you know that you really are dealing more with the seasonal allergies that you have had in the past. But unfortunately, there is no easy way to tell between influenza and COVID as simply as we possibly can, and I wish we had that. For those of you who have had a COVID test, you know how uncomfortable it is. I've been fortunate to have two, or unfortunate to have two. I've tested negative for both, and actually I just had one 2 days ago as I had my screening colonoscopy yesterday. So talk about transparency. I'm going to tell you that I had that, and really show the importance of everyone, especially those who are trying to screen and fight for colon cancer, to do that. That being said, let's go back to the COVID testing. It is uncomfortable, but we will have an opportunity to have a single swab COVID influenza test, and that is in production right now. So if we do have that concern, is this COVID or is this influenza, we'll have the answer after one test, so that will be good. Should I get a flu vaccine? 100%. Everyone, for you and your family, should get the flu vaccine this year. Now, many of you may say, you know what, I've been stuck with needles so much that I don't want to get a shot. I hear there's something called the flu mist, and it's been approved again. Can I get that? Oncology patients should not be getting the flu mist. You can discuss it with your oncologist, but most, if you look at the CDC recommendations, they're going to ask that you get the flu vaccine versus the flu mist. And there's a couple reasons for it. One is the flu mist is a live vaccine. It's attenuated, so it really can't cause harm and really can't multiply, but it's a live vaccine. But more importantly, we have found that the vaccine that you get in the shot has a much better response rate. So we want to make sure that we protect all of you as much as we possibly can. Those of you over the age of 65, and some of you who your oncologist may have told you to get the high-dose vaccine. That's very possible, so discuss that with them. But if you're over the age of 65, please get the high-dose vaccine. It's available, it's out there now, and that's the one that we really want you to get. And the reason for it is we know that as we age, our immune system does not work as well. So we're going to get that higher dose to make sure that it works. Very similar to what you're seeing with COVID, where you're going to need that booster vaccine. So get the high dose if you're over the age of 65, but this is certainly 1 year we want to make sure that everyone gets the vaccine. It'll decrease the burden in the hospital, it will protect you, and eliminate that option or that opportunity that this may be a COVID virus. There are studies being done now that started actually in the southern hemisphere, just because of the timing of COVID, that are actually showing that the vaccine may actually help protect COVID as well, protect you from COVID. Not that it is up against that vaccine. The vaccine is specific for the viruses that we're seeing in influenza, so there's no COVID in there. However, it is being seen that the turn on of your immune system may actually help individuals as well. So please, this is definitely 1 year. Can I get together with my family this Thanksgiving? You know, we have 3 major holidays coming up here, 4 major holidays, so I can't leave the kids out. Halloween, Thanksgiving, Christmas, and New Year's. Is anything going to change between now and then? I'm very sorry to say no. This is my personal opinion and my professional opinion, so please take it and do with it what you'd like. From a Halloween point of view, I certainly would say please do not do the trick-or-treating. I know it's bad for kids. I know I feel sorry for the kids, but you have to understand that they're children. They can be asymptomatic carriers. They're running to the front of your house. You're opening your door, and they're yelling at you, trick or treat. Boy, it used to bring smiles to our face in the past as we see these little kids enjoying this. This is 1 year that I'm afraid to say it's probably not a good idea. Having multiple, potentially hundreds of kids coming to your place, yelling at you from a very short distance away, just has an opportunity to spread this illness that we really should not take this year. Thanksgiving, Christmas, and New Year's. Thanksgiving, one of my most favorite holidays. I host my family at Thanksgiving. I take that opportunity to give us all an opportunity to say what we're thankful for in the year. And I'm sad to say that for our family, we've canceled that tradition. This is a very tough one, but we know as we're getting close together with potentially asymptomatic people who can spread, we say, why risk that for 1 year? We'll do a Zoom call. We'll share what we're all thankful for. But really, these holidays, especially now as we're starting to see the increased number that we're seeing, as well as what's going on in the communities here, and I'm just afraid of what we're looking forward to, that make alternative plans for these upcoming holidays. Please show what you're thankful for. Please give gifts as you would at Christmas. But I'm not sure that the close social interaction is something that we really is safe or healthy to do this year. Many people, I've shared this on the radio numerous times. People have called me Scrooge. People have called me that I don't like little kids. And I'm just looking at it from the science side and trying to safely care for everybody and minimize any spread that we have of this illness so we can get back to what our normal is. Does the history of cancer raise my risk of health complications from COVID-19? It's a very difficult question, and the reason is that we use the word cancer very generically, correct? So if I had lung cancer, would I be more concerned? Absolutely. I've had damage to my lungs. I have condition in my lungs, and that's one area that COVID hits. But for the most part, it's not so much the complications of, because it depends on the individual cancer you have, but it really depends on your transmission and your ability to get this illness. So I think we all need to be careful regardless, but I tell people all the time to be very careful around those who are vulnerable, whether they're on chemotherapy or whether they have been cancer patients in the past. We know you're a little bit more vulnerable, and we want to make sure that we protect you and those around you. So that would be my answer to that question. Let's see here. I'm a caretaker of my husband who has stage 4 cancer, colon cancer. I work in a retail environment. Aside from wearing a mask, social distancing, washing my hands, is there anything else I can do to protect myself and my husband? You're doing everything you can outside the environment. That is great. Do everything that we talked about for your immune system inside your environment. You may be exposed to people in the retail world a lot more. Hopefully you have a plexiglass screen up in front of you if you're in that type of retail, and that you're doing everything you possibly can. I tell people really the main thing to do when you get home, before you go to give your husband a hug, please make sure you wash your hands. If you're anxiety provoking at all, please go change your clothes, put your clothes in the laundry, anything that you may be concerned that you're bringing this virus home to your husband. But it's just wise things for all of us to do. Often when we come home from wherever we've been in the outside, the main thing we can do, wash our hands and make sure that we're careful there. Physically distancing as much as you can at work. Anything to minimize any interactions is going to be important. And we hope your husband does well with his cancer screening or with his cancer treatment. We had other questions as we're kind of hitting kind of I'm not going to end right at the 11:30, but we're kind of hitting some questions more about individual cancers. Will it Waldenstrom's? Will it be multiple myeloma and other cancers? I think that the biggest things that we're doing here is making sure that we're protecting ourselves. One of the questions was someone is having someone come in to do work in their home. Many of you may have cleaners that come in to do work in your home, or making sure your heater is ready for the winter. So the biggest thing I'm saying there is that all the workers who come into your home should be masked appropriately. You should physically distance from them as much as you can. If you're concerned, leave the house while they're there. People want to know, can I leave the windows open, fans on? Absolutely. We know that air will dilute this. The aerosolized portion of it, which I'll talk about in just a minute, is obviously a concern that has been brought up just recently. But really, masking yourself, making sure that all the workers have masks on, distancing as much as you can. Don't shake their hands. If you don't even want to, don't even elbow bump with them. Keep your distance at all times and thank them. And then if you're really concerned, leave the area for a while and let it air out, anything that's in the air, and then clean any areas that you know that they may have been around. If a worker is working on your dishwasher, on your heater, you can go down and clean that area with antiseptics and bleach and Clorox. But I wouldn't be overly concerned. Be more concerned about the individual and the close proximity that you get to him, as we know that over 99% of these infections are spread by person to person, not by touching a surface. I will say one thing about inside areas as we go into the colder seasons here. Many of you may have heard, well, wait a second, the CDC now said that this is not just droplet, where we're talking about 6 feet of projection, but we're also talking about this being aerosolized. And aerosolized means that it can go greater distance, 12 feet, 15 feet, 20 feet, and really depends on the circulation, air circulation. So if you're in a poorly circulated area, certainly that is one where there is some concern that this illness can be transmitted a little bit more easy. That is another reason why I look at, the holidays, the inside holidays of Thanksgiving and Christmas and New Year's, close proximity with people in areas where there's not great air circulation. People say, well, I have a great heater, I have a great air conditioner, I have a great fan system in my house. Those are all great, and if you are going to continue with those family traditions, please make sure that your fan is on, whether you need heat or air conditioning, at least have the fan on. Any ceiling fans that you have on, please use those, and then any other fans, and circulate as much air as you can in the house. In the hospital, we look at air turnover rates. We turn over the air in the hospital in our rooms, every couple of minutes. In a typical house, that doesn't occur. You don't have the HEPA filters that we have in the hospital, so you don't have all of the equipment and the opportunities that we do. So please do everything you can if you are going to decide to continue with those traditions to make sure that you circulate air as much as you can. There was an individual question about testing and healthcare workers and are we being tested. I told you I was tested 2 days ago. Prior to that, I was tested once by the PGA Tour. I was the medical director for the BMW Championship and went into the PGA Tour bubble for a week. Those are the 2 times that I've been tested. But besides that, we really are not doing a lot of testing in the asymptomatic healthcare worker. And there's a couple of reasons for it. One, we know that the use of PPE has shown that healthcare workers are not spreading this within the hospital. 2, we also know that if we were to put a testing burden on all hospitals and healthcare providers, whether it be in nursing homes or hospitals or doctors' offices, that we would not have the adequate number of tests across the country to test those that we actually need the test for, to identify those individuals, to place them in the right area in the hospital for their treatment. So testing the individual hospital setting, we're not doing that yet. What are we hoping for and waiting for from the testing point of view? And it's being worked at, is a breathalyzer test. A simple test where you would blow into a machine and you would be able to identify the COVID virus. That is really important, because then we can get back to sporting events, we can get back to social events where we could do a very quick breathalyzer test. It's being worked on, and if you think about it, the tests that we do from the nasal, we know that this spreads by talking and speaking and singing, so it certainly would make sense that a breathalyzer would be our golden nugget for testing. I know there's a few more questions, and I'd be more than happy to take some of them.
Yes, okay, we had one that came.
Will they be able to hear me, or will I need to repeat your question? Okay,
sorry,
that's
yes,
okay.
I'll have to
Yep.
repeat because I'm not
Yep.
the loudest. We did have a question that came in from Sylvia asking, what are the lymphatic complications of COVID-19?
Yeah, so Sylvia is asking about the lymphatic complications of COVID. We're so early on that we don't know what the lymphatic complications are. Will this make patients with lymphedema worse? We're not sure. Will this impact, that portion of our immune system? We're still not sure about that. Only 9 months into this illness, we're really finding out more and more, and you're starting to see things like in the last couple of weeks, the COVID fog that came out. So certainly something that is being looked at, and especially in oncology patients. So I wish I had a great answer for you of what the effect is, but like I said, this is a nasty little virus that doesn't decide to stay in one area of our body. So do not be surprised that it may have an impact on our lymphatic system as well.
Sylvia is also asking, why is red eye considered one of the symptoms of COVID-19?
Sylvia is asking why red eye conjunctivitis is one of the symptoms of COVID-19. And you probably have seen healthcare workers, and one of the unusual things about healthcare workers right now is they're wearing goggles, face masks, not just the simple mask, the N95 mask that we were wearing initially. And the reason we find that is that COVID can unfortunately also be transmitted into the eye. So we know that that's a transmission point. So that's why we're wearing the goggles and wearing the face mask, and that's also why red eye conjunctivitis can be a symptom. The term conjunctivitis just means an inflammation of the conjunctiva, the white portion of our eye. It can be caused by allergies, it can be caused by viruses, and it can be caused by bacteria. So it's one of the other reasons that we are protecting ourselves, but it's also why it's on the symptom list for COVID.
One last question, I believe. Michelle H. is asking, what is the viral load of an asymptomatic or pre-symptomatic COVID-19 carrier? Is the shedding of the virus the same as someone who is symptomatic?
So Michelle is asking a question about the shedding of the virus, the viral load, and really, I guess more importantly, when are we the most contagious, and can we shed as an asymptomatic person? There's lots of studies being done on this. Unfortunately, some of them we can't do. In other words, we don't know about the asymptomatic person until we have found them, and we don't know then how long were they asymptomatic. So when we look at the viral load, what we can tell is that people are shedding the virus about 1 to 2 days before the symptoms at the highest levels. That's probably the most concerning time, and then they're going to continue to shed for up to 3 to 10 days after that. We're really looking at most people at about day 10 after their symptoms have started is that they're really not, quote unquote, contagious. They still may test positive, but they don't appear to be shedding the virus at a level that it's going to be impactful. That being said, if everyone is wearing a mask, we know that we're going to be much more careful. Even if you are at the point of having the illness, you're cleared the illness, but yet we are still going to expect you to wear a mask for one of two reasons. One, you're going to be able to continue to protect yourself, and two, we're going to be protecting others. It's a misconception that people have right now is that once I have this, that I have immunity to the illness, and we don't know that for a fact, and that's why we're going to continue to ask people to wear masks, not only to protect themselves, but to protect others. We do know that the asymptomatic numbers are coming in very interesting. If you saw and if you read the newspaper on Sunday, the SCAN study, and this is one that many of you who are listening may want to participate in. The SCAN study is a very fascinating study that looked at 5 sets of 2 zip codes next to each other in the city of Chicago, and they mailed out blotter tests to those individuals. And we know that the positivity rate in the state of Illinois is about 3.8%. In the city of Chicago, about 3.8%. The SCAN study, however, with individuals sending back these droplets of blood where we tested to see if they had antibodies, showed that the rate was actually closer to 20% of individuals had been infected. So those of you who are interested as to whether or not, hey, did I have this in the past? And if I do I have immunity? And if I do, will I have continued immunity? Please go on to Northwestern's website. You can go to Northwestern and then just Google or go in the search box and put the SCAN study. They have extended this outside of Chicago now, and it's a very interesting study. There's no cost to you. You can get out of the study whenever you want, but it will give you an idea, one, if you've been exposed and not known it, the large number of asymptomatic, and two, what we're really trying to do now is to find out that those who have had it, will they continue to have immunity? So you'll continue to send in little drops of your blood onto a card that will then be tested, and you will get the results back as to whether or not you had the infection and whether you continue to have the immunity. So I think that hit our questions. And okay, no, absolutely, I'm fine.
Okay,
yep.
One more. Eloise is asking, would air filters be a benefit in the home? You've kind of touched on air filters already, but
yeah. So Genevieve was it? Eloise. Eloise had a question about air filters and air filters in the home. And I want to make sure that I answer the question properly. We all have air filters on our furnaces and our air conditioners. Those filters are great for dust and dust particles and larger particles, but they really don't get to the level of HEPA filters, which gets about 99.7, 99.8 out of the air. So those individuals who are in a home and you're in a vulnerable population and you're going to have anybody in the home, having an air filter system that's small that you can use in a specific room that will be at the level of a HEPA is absolutely great for you. If you can get HEPA filters for your furnace, those are great. You're going to, again, filter out as much as you possibly can. But for the most part, the hospital grade and airplane grade HEPA filters are probably not available in the home setting as much. So I think we've come to the end of our time, and again, I appreciate the opportunity to answer your questions and share at least my thoughts of what's going on. And again, from the people at Living Well, please stay safe. They miss you. Please participate in their 100+ virtual programs that they have, and they can't wait to get you back, but they want to make sure that you stay as healthy and as safe as you can through this time. And if this continues, I would think that Living Well may ask me back again to restate what I have said in the past and to correct what may have been wrong or has changed in the future. And I'd be more than happy to come back and educate you and share my thoughts with you in the future. But until then, please wear a mask, socially distance, wash your hands, get a flu shot, and let's keep everybody healthy. And if your kids are upset about Halloween and your family's upset about Thanksgiving and you make the decision that I made, you can blame me, and I'd be more than happy to take care of that. So thank you all, and please stay healthy and safe.